Morning, everybody. It's really a great pleasure to introduce today the speaker in this session. It's Dr. Moses Kamya. It's a really great pleasure to introduce you. He's a professor of medicine and current chair of the Department of Medicine at the College of Health Sciences in Malaria University. And probably you know that he has been formally trained in internal medicine, but he's really an expert in malaria and HIV projects. So his training is started in Malaria University and also in epidemiology in the University of California in Berkeley. And he has a PhD in biomedical sciences for the University of Antwerp in Belgium. And he has more than 20 years of experience doing research in HIV and malaria. And he has been, conducting research and having more than 120 publications in all this time. He currently serves as a principal investigator and co-PI of multiple malaria and HIV projects. And one of these projects aims to assess the role of HIV-1 protease inhibitors in the prevention of malaria, which is, I think, really fascinating how these, comorbidities actually can really interact. He serves as an editor of the Uganda Antiretroviral Therapy, the ART clinical guidelines, and is currently chair of the Ministry of Health for the Adult ART Management Subcommittee in the country. So again, it's really a great pleasure and an honor to introduce you, Professor Moses. Maya, I really hope that, I'm pretty sure that all the fellows here will be really excited about your talk. Thank you, and the floor is yours.
Thank you very much. Could I screen share, please?
Yes, you should be able to.
So meanwhile, we get the screen. Again, remember, you can probably interrupt Dr. Moses anytime, but probably the best, for the sake of time, is keep the questions for the end. And you can definitely post those in the chat. We will keep track of those, and we'll be having some discussions at the end of the seminar.
Okay. Is that, can you see my screen, I guess?
Yes.
So should I put it in slideshow? You can, I guess you can see it now.
Yeah, that's perfect. Thank you.
Well, good morning, good afternoon, good evening, everybody. Nice to meet you. I'm sorry I'm not putting on my video, but I hope we will have good interactions. Thank you for introducing me. So I'm going to share something about my research career, highlights and challenges. I hope maybe you will learn something or two from my experience. So as I've been introduced, I'm a professor of medicine at Malaria University, but I also direct a research organization called Infectious Diseases Research Collaboration, IDRC in short. So I'm going to talk about these things. This is the outline, my academic career and networking, collaboration, always working across cultures and securing funding and all of those things, balancing professional life. But I don't think I'm going to go into any detail about this, but perhaps there will be a slide or two trying to show what my experience is under each one of these topics. So my training academic background has already been talked about. I did my training at Malaria mostly, and then went to Berkeley for public health and then did this PhD in Belgium. And of course, I've had some other trainings at certificate level here and there, and lots of non-degree trainings that are not listed here. So that's really my academic background. Generally, I'm an internal medicine doctor, and I see patients with infectious diseases and do research and a lot of public health in collaboration with the Ministry of Health in Uganda. So I guess this is a repeat of a number of things that have been over the years. You can see them there, and I think you have access to the slides. So I've seen the academic life, the clinical life, the administrative side of things, being chair, being dean, and being many things over my professional life. So where did it start? I'm just going to begin from when I was doing a master's degree in early 90s. So in the early 90s, I did, we call it master's, but I think it is known as residency in the US or whatever it is in other countries. But at that level, I did some work on STDs. This was really real fun to do. I ran around, enrolled patients in the STD clinic, patients with genital ulcers, did their swabs, did lots of things to sort of like diagnose what was causing their ulcerative disease, what was causing their genital ulcers. And I described the high prevalence of genital herpes in Uganda in 1995. I really like this paper because, I did everything myself without much help from others, and publishing it made me feel very proud. So after that, I had some contact with the people who are working at UCSF. They were involved in some other studies at the STD clinic, and somehow they spotted me and recommended me to go to CAPS. CAPS is in San Francisco at UCSF for a 3-month course. So while at CAPS, I developed a proposal on condom use, and then we were given some small amounts of money to come and do work, to come and implement the proposal that you develop while studying at CAPS. So mine was condom use with casual partners. So I did this study. Again, it was fun to do. It was a community-based study. I randomized communities, some of them to receive condoms using peers, and others using various venues. And then I found out, what was, anyway, it was fun to do. Perhaps I shouldn't go into a lot of detail. Then after coming, while I was at CAPS, I was, I think I did very well. Somehow people recommended me to do an MPH at UC Berkeley. So I returned to Uganda for a little bit, then went back to UC Berkeley and did an MPH. And after doing the MPH, I came back. Somebody offered me a job to do, to coordinate a study on Mycobacterium vacci. This was a randomized controlled trial. We gave Mycobacterium vacci immunotherapy to HIV and infected adults, and we were looking at various outcomes. Some were immunologic outcomes, and others were clinical, looking at sputum clearance. Now, this study, I really acted as a study coordinator, but it was a very important one for me to learn the research process and learn a lot of things about clinical trials and learning about outcomes and learning many things. So that was real hands-on, and it was again a stage milestone in my career. Then while working at the TB unit in Uganda, coordinating this study, I asked myself, what will I do after the study is over? And, I debated whether to continue with TB or with HIV or move to something else. And then I realized that really there were not many people in the malaria field. Sometimes, you move from different fields of research and then find a niche somewhere. So I, as I will tell you later, I applied for TDR, WHO TDR small grant to begin some malaria research work. So I moved to malaria because I thought it was less crowded. Maybe that's the reason. And this was like the first paper. Forgive me for repeating fast. But this was the first paper that I published as first author, comparing, drugs which we were using at that time. So I moved into malaria from HIV, TB, and now malaria. Then I thought that, look here, I have a background in malaria and HIV, and I started to develop interest, in the interactions between the two diseases, and actually this became the area of focus for my PhD work. Some of these studies are listed here. You probably can look them up. The second study there, antiretroviral agents and prevention of malaria in HIV-infected children. We at that time it had been described that protease inhibitors have activity against malaria, but then we did a study expecting to find that, and we found actually that the most important effect was the interaction between antiretrovirals and antimalarials, and that caused, increase in antimalarial, it's particularly lumefantrine, increase in one of the partner drugs for treatment of malaria, and then people who got protease inhibitors plus antimalarials ended up, having a longer protective effect against malaria because of a drug interaction. Anyway, it was really very nice to understand some things about interactions between the two diseases from the disease level and from the drug level. So currently we have a real thriving research collaboration. You can look it up between, it's a local, IDRC is a Ugandan research collaboration, but we collaborate mainly with UCSF, but also with many other people. And we do research on infectious diseases, non-communicable diseases. We do collaboration with Makerere, with Makerere University, the Ministry of Health, UCSF, London School. And, the collaboration is so big that our publication record is very high. We now publish like 80 papers in a year. So it's about 1.5 papers a month. You can't even keep up with the kind of productivity that our collaboration is having currently. And over the years, our research has generated new knowledge in infectious and non-communicable diseases, and we think we've greatly impacted on national disease control policies. We disseminate our work. In fact, recently, last month, we did a dissemination meeting, which you can see here. We really make sure that those important lessons that we learn from our research gets into policy or programming at the ministry level. And so I guess you should be encouraged to see some ways of getting your research. When you see your research getting used, it's really a big achievement. Now, collaborations are very important. I'm showing you here some of the people I've worked with for many years. Some of them as many as 25 years, and such long-time collaborators. Working across cultures. I think I should have put somebody from Africa here. All of them are Americans. It should be. It's like I'm collaborating with Americans only, but there are some others who are not Americans. Maybe one point to say about networking collaboration is that people all over the world are the same. I think what brings us together is much more than what divides us. And I think the more you know people, the more you realize that people are inherently good. And so if you have a collaboration, it may be rocky at the beginning, trying to learn about each other and about each others background and experience, because we all grow up in different places. But over time, you learn that the barriers that were there at the beginning keep getting better. So these people have collaborated with them very, very well over many years. We've done a lot of capacity development. I think every research program should have capacity development, because as you can see, many of us are getting old, and some new blood comes in with new ideas, new whatever. And I think, one of the things that makes me most happy is to help someone who is young in their career. Whatever I can do for them, whether it's a letter of support or it is making it easier for them to do something that they want to do, I think I would be very happy to do that. It makes me really glad to see people grow up and establish themselves. I don't think I'll go through all of these training programs. They are funded largely by the NIH, but also by the Wellcome Trust and others. So this is our capacity of local scientists, which we have developed. I've put some pictures here for you to see. And many of these people have PhDs and are highly, quite highly well trained in different fields, as you can see there. Now, there are some people that I've supervised over the years, and some of them make me very happy. And you don't know them, so I will not go into detail about them, but certainly it feels very nice to like I said, to play some role in helping somebody make their own careers. Now, in terms of research funding, to me, this is where I worked with people on, with people who had research grants that they had won. But in terms of my own, the very, very first grant was a malaria one, this small grant, which is a WHO TDR grant. It was, I think, $40,000 per year over 3 years. And, we managed to do some clinical trials using that small grant. It doesn't give you a salary, but you are able to do things. So this was a small grant. And then later on, one of my collaborators, Phil Rosenthal, got another O3, which was also a small grant. And then we had 2 small grants. So, it's always small beginnings that lead to big trees. It's like a mustard seed leading to a big tree. So we had small grants, and then we had relatively large grants, And then we had larger grants. And of course, the larger the grants get, the more you need a multidisciplinary team, the more you need diverse expertise, and the more you need collaborations and partnerships. So with a small grant, you can work alone, but with the bigger grants, you need to work with others. Something about successful grant writing. Certainly, there are many people who write grants better than myself, but I can tell you the few things that I know about. First of all, it takes time to write a good piece. It takes a lot of time and planning and being up to date with the literature. And it takes a lot of peer review. Everything I've ever written, the more it is peer reviewed, the better quality it becomes. And if you get something peer reviewed until somebody cannot even find, a wrongly placed comma or something, before the English is right, and then you are doing a good job. But certainly peer review is extremely important. And of course, with any RFA, you should read it 100 times to be responsive, so that you increase your chances of winning a grant. Building on prior work, I think, is extremely important. If you are going to write something successful, I think you all know you need to describe preliminary work and work you have done, and building on what you have done to be able to convince people that what you are proposing is doable. And as I said before, building a strong team. I think working alone is not easy. You can do it at the beginning, but over time you realize you need others to work with, and building a research team is an important goal for everyone. And then leveraging the infrastructure that you have built. At IDRC, we built some infrastructure. It is easy to do things because of the infrastructure that exists, be it clinical, lab, data, administration, finance, what. Each one of those things helps one to place a grant into an existing infrastructure. What's been important in my career, standing out has been important, at least at the beginning. Most of the opportunities I received at the beginning was because somebody spotted me. Some friend of mine, Dr. Jerry Elner, some of you might know him, is a TB guru. He gave me a job because I answered some question in ID, which he didn't think anybody knew about. he asked a question and I answered it. So anyway, standing out in many various ways gives you some leverage to be seen by others and to be promoted by others. Building lasting relationships. I think that I showed you my collaborations. I think that it takes time to build relationships, but I think once you build them, then it makes it easier to have successful research program. Building research teams, identifying talent among early career scientists, collaborations. Integrity is very important, especially in Africa, where if you get a grant, people think, oh, there's a lot of corruption and what, and then people get surprised when everything goes well. So I think integrity in financial and otherwise is very important for one's success. And of course, hard work is important, and balance. I gave you this picture. I hope you enjoy it. This is my grandson. He had visited with the mother, and I was extremely overjoyed to. So this is part of balancing things. I think that there are always opportunities to optimize a busy life with other things that matter in life, be it family or otherwise things that matter to you. I think having a balanced life is extremely important when one is busy doing research and chasing their academic life. So anyway, it looks like I've come to the end of my talk. I don't have too many things to say. It sounds like I've come to the end of my talk. So thank you very much for listening to me. I'll be happy to answer questions and even for us to discuss and to know you. But otherwise, I guess I've given a bit of my story. Yeah.
Great. Thank you so much for sharing. It was awesome. Yeah, I agree with the comment that Scala was talking about. Definitely, it's extremely valuable to have. You probably hear the noise of baby in the background, so kind of similar scenario here. Having a baby, and yeah, it's usually complicated to balance with all the career challenges sometimes, but it's extremely important to be able to do it. So thank you so much for sharing a super interesting story. So we are open for questions. Anybody wants to, again, feel free to unmute yourself and just ask directly Dr. Kamya, or just put your comments in the chat. Okay, there is a question, I think. Ernest says, thank you for sharing, Dr. Kamya. Can you talk more about working with government to translate research into policy? Really, really great question.
Yes, can I share our experience working with government to promote policy? Now, I think that within a research program, it should be an important goal to establish relationships with the Ministry of Health, because they are really the consumers of our research. I mean, they are not the only consumers, but they are the main consumers of our research. So establishing those relationships is very, very important. And maybe let me mention a few ways that you can establish relationships. For malaria, for example, right now we have a lot of activities that are leading up to the Malaria Day on Monday. I think it is Monday 25. So our research program, supports a lot of things that are going on. We have even, gone to do some exhibition. We try to support the ministry to do things. We are part of the committees. So we generally try to embed ourselves in what is going on at the ministry. They've got working groups that we try to work with, working groups for their control program. They've got meetings that we try to attend. So we show that we are part of malaria control. Although we do research, but we think our research informs programming. So we really want to be part of even some discussions on the programming side. We are part of it, they invite us. So I think you need to develop a relationship using various ways to sort of ensure that they see you as part of them. I'm not sure that I've answered everything, but that is what we do. We are part of the ministry in so many different ways. Can you talk more about working with government? What challenges, there's this one, what challenges did you encounter as you progressed on, and what advice would you give to overcome them? Now, what are the challenges? This is Stephen. Now, I'm not sure challenges at which stage. Certainly, challenges are part of life. I think what have been my challenges? Stephen, could you be more specific? Challenges in what? In what area? Maybe then I can be more specific about the answer.
Thank you, Professor Moses. So I mean, challenges like how to overcome failure when you don't get like funded. There's that peer review rejection when your papers get rejected in a peer review. And then when you try to submit even a small grant, the reviews tend to be, you think the reviews tend to be really extremely biased, even when you think the idea is good. How do you work? How do you really use failure to turn around issues? Thank you.
Yeah, I think I've got it. I definitely in a research academic career, there are always those challenges. But specifically about papers and grants, applications, and all those challenges. You write a paper, it is rejected 100 times. You write some grant, you write a grant, and you are not successful. You think your ideas are great, but others don't see them that way. So I think it happens to everybody. I don't know whether maybe there are some, but if they are there, there should be very few. I think everybody faces those challenges. The way we deal with them is to never give up. If you think you've got a good idea, I think it is good for you to convince others about that idea. You may have to apply several times. You may have to submit your paper several times. But eventually you win if you don't give up. Now, something I've found important and useful is to share your ideas with others, or maybe even to share your paper if you are publishing, or your grant idea with others. They might tell you that, look here, this won't fly, or they might tell you it will fly, or they might help you to tweak it so that it flies. I think working with others and bouncing your ideas on others is extremely important if you are to be successful. So it can be frustrating, but it is normal for everybody to have rejections. In fact, the grant you think you've written extremely well is the one that gets rejected, and the one you don't think you've written well. But I think the solution is to have peer review, is to have others give you their ideas, is to make sure that what you write is reviewed 100 times over to make sure it's a good piece. There's a hand up. Should I just?
Yeah, Scholar, probably. I just wanted to follow up on that question because I think it's a very typical question about the challenges. You guys can definitely always try. Definitely, it's very challenging all our career, and first to get maybe a researcher position in the first place is really difficult, right? You have to get a lot of titles. Dr. Moses was saying, like a lot of training. It's a career in which you have to continuously train yourself, get a lot of insights, fight for funding, and then so on. But I think that these challenges many times are opportunities. And again, I can put an example that happened to me. I was meant to be a typical veterinarian, clinical veterinarian. I went to the equine and small animal residencies and so on. And when I applied to the small animal residency, I tried to, do all the things that they request and so on, to get on the top of the list, right, in terms of merits. But that year they changed the system and they decided to do it just, randomly selecting candidates without considering the merits. So I'm always very bad luck in terms of, lotteries and things like that. So I was not selected. So I was so frustrated. I thought, oh, my entire career is going to be gone because, I don't get this possibility to get the training where I want and so on. But then other opportunity opened up that end up being actually better than the previous one that I was thinking. That was really what I was meant to do and to be. So again, many times the challenges that you encounter in life open the door to other opportunities or give you more resilience sometimes to, seek with more passion what you're looking for. So again, I would try not to be discouraged with, rejections from your projects or your papers and so on. Many times those give you really constructive criticisms and you can use that to improve your, not just to strengthen your character and be more resilient, but also to explore alternative venues that could be even better than the one that you were exploring in the first place. So yeah, so I think it was a great question. Sorry, Scala, you can just go ahead now. Oh, I think we lost Scala. Let me see. Yeah, I know that there were some people dropping. I don't know what happened with the internet, maybe. Yeah, we lost Scala, so I don't know. Probably was pissed off because of my intervention. Just kidding. Okay, so any other questions or follow-up? Because I think that that question was very important about the challenges again. And you guys are young, and the new generations. I know that one of the studies that were recently published is that you see that the world is like super difficult for you, like, you have the climate change, all the political issues and so on. So it's a generation that's been, and the pandemic, of course, it's been under a lot of pressure and a lot of probably negativity around, but there is a light after the tunnel. Okay, so you guys again you're the future basically to keep moving with research and to keep all the amazing insights and contributions to science and that we need basically to advance in society. So again, I think that you definitely again are actually in this program even more, right? It's really just an elite of people, that the one that is here. So again, just use that challenge as something that is going to help you in your career. Okay, any other questions or comments in that? I saw that there were, some people dropping and then catching up again, but I don't know. We lost Scala, was the one with the hands up. Probably was saying that I was gonna have to leave, but. I have a question actually, Professor, regarding the, all the amazing trajectory, right? Like all the training that you receive in the different areas and so on. Again, many times, at least is also my experience, like you have to do all this training to really come up with, the strong foundation, probably to get a position, probably where you want to have it, and also to, excel in your research. But it's a long career. I mean, many times you think, oh, you have to do medicine and then, residencies or trainings, PhDs and so on. You end up being, I don't know, 40 something, and then eventually you get a permanent job. So yeah, what kind of recommendations or thoughts you have in that sense, that, many of these fellows are looking forward to come up with their own research team, being PIs in prestigious universities or other research institutions or in government bodies. What kind of recommendation would you have to try to achieve that dream and not give up? Sometimes again, it's a long career.
Yeah, thanks. how so the question is, if I understand it, the training, long-term training leading to what, to successful career, or
Yeah, so most of the fellows also, like, again, this is like a postdoctoral, or is a fellowship for those that are in the early career, and they're hopefully trying to get into a research, like a PI, and being researcher is a faculty in an institution, or principal researcher in a research institution, National Science Foundation, and NIH, or any government body. So again, it's a very long career, and you have to get probably a lot of fellowships, and then jump into another, like maybe early career investigator fellowship again, and things like that. But what would be your suggestion in terms of again, how you think that this could be done, not accelerated, but how you won't be giving up, or what are the recommendations, basically, based on your experience? I don't know when you got your permanent job, but again, it seems that you did like a lot of training before getting there, or you think it's better to do all this training, or try to achieve like other how you say, like other routes. Basically, you can just get a job, and after getting the job you get the training, because that's another option as well. Some people just get into a government job, for example, and then they jump into the PhD maybe, and with all that experience, keep advancing in their current job. So I don't know, that was very clear now. It was just trying to break.
I think I get the question. You're asking. I don't know whether there is one specific path to follow. Really, personally, I got training, then somewhere in the middle, I got into a permanent job, and then continued training, and then certain things happen like concurrently. Because getting into some kind of junior level position at an institution is helpful. I mean, at our university, we have things like honorary, I think in America it is adjunct or something, I don't know.
Yeah, or assistant professor, something like that.
Yeah, I think there are equivalents in different places, but I think getting into some kind of position while you are training may not be a bad idea. Of course, it's a junior level position, but then it gives you leverage to be promoted once the training is over, or as you begin to establish yourself and publish papers and whatever, then you get promotions along the way. So there's no one formula, but I think that one needs to be determined to work hard. You need to have some kind of individual development plan, what you want to achieve, when you want to achieve it. But I think if one wants to have an academic career, it's maybe good to be attached to some kind of academic environment where you can grow. So I think it's really no specific path, but I think that early on one should try to get some kind of position with some academic institution, and then keep building up as you become PI. I don't think you should really first become a PI before you get a position somewhere, because they go together. You get promoted at the position where you are as you advance your career. In fact, the institution where you work gets credit when you do good work. So it's somehow, I think, a mix. You have to do certain things concurrently. That's the way That's the way I see it. At least that's how it has happened. I trained, and then somewhere along the way, I got a faculty position, and then trained more, and then, and then got promoted. But it takes a lot of hard work and perseverance, and you called it resilience, and yeah, to keep moving on and overcome the barriers. There are very many. Of course, positions sometimes are not easy to get. You need to get positions, because you need to really work hard, and again, that's why I say somehow maybe you need to stand out, get mentors, people who can promote you, because you never, it's very difficult to promote yourself alone. You can, but you need some other person to hold your hand, and somebody who may be in the boardrooms where you are not. So you need mentors to quite early on to navigate around many things on your path to.
Yeah, absolutely. I think it's a great advice. Definitely, it's again a long career, but as you said, with hard working, and some of the feeling that I have with some students that are also in this level, and they always ask, well, but again, it's very difficult to get a faculty position, at least in the prestigious universities that you want to go, and so on. And most of the other options are like research positions that is soft money. Basically, you have to get your own salary. So it adds a lot of pressure, and to get funding and so on. But again, many people goes through that route, and they are extremely successful to guarantee not only funding for themselves, but also funding for people in their team, to mentor students and things like that. And eventually you may end up having, again, maybe a faculty position with at least some part of your salary covered. But yeah, it's a long journey. I agree. The mentorship, I agree, it's extremely important. Also, it's selecting well the team that you're joining, and yeah, the networking of collaborators and workers that you decide to work with. Awesome. Okay, any other questions? I'm sure that you guys have a lot of other questions. Thank you so much, and Dr. Karen, saying your perspectives. Okay. Yeah.
Well, one of the things maybe I can say here, based on my experience, very early on, I was earning extremely little. I was barely surviving. While even all of those small grants were not paying me a penny, apart from paying for maybe my telephone, for some communications and what. So it took me some time to earn a decent salary. So I don't know, other people may have different experiences, but I think working your way up may mean, a bit of sacrifice in terms of how much you earn at the beginning. Certainly, later on, you begin to earn a decent salary, but it may not be so at the beginning.
Great. Okay. No more questions? Okay, well, yeah, we don't have more questions. Diana, go ahead. Yeah.
Okay, no worries. Thank you, Dr. Kamya, so much for presenting and just sharing your experiences with your career trajectory.